Hi, my name is Dr. Cheng Shi-Hui from University of Nottingham, Malaysia, and today I'm going to present my paper under the domain of clinical and public health entitled Changes in Lifestyle, Mental Health and Body Weight Status among Malaysian Adults Before and During the COVID-19. So, since the outbreak of the COVID-19 in 2019, a nationwide lockdown, known as the MCO, has been implemented by the Malaysian government along with the stringent SOP, and this has an impact on the physical activity as well as the mental health status of the Malaysians. So we hypothesize that during these hours, during the COVID-19, there will be a reduction in the physical activity and an increment in the sedentary behavior, which will link to the increase in the snacking frequency, and this would then increase the body weight status. And we also hypothesize that during this period, because of the mental health increase of the mental health status, as measured by stress, depression, and anxiety, this could link to the overeating as people crave for comfort food, especially for those who are under stress, as depression, and also anxiety. And this would also link to excess of the food intake, positive energy balance, and increase in the body weight. So our objective for this research is to determine the changes in the lifestyle, mental health, and body weight status among Malaysian adults before and during COVID-19. So this is a cross-sectional study. The data before COVID-19 were collected from September 2019, and data during the COVID-19 were collected from November 2021 to February 2022. So this study was approved by Science and Engineering Research Ethics Committee of the University of Nottingham, Malaysia, with the identified number NGF 061121. So our research, we recruited the patients via the snowball sampling from the email and also the social media platform, including WhatsApp, Facebook, and Instagram. Our inclusion criteria were Malaysians aged 18 years and above, and we will exclude those with the COVID-19 infection and those with the condition which will affect the lifestyle behaviors and the mental health, such as pregnancy. So in our research, we have used an online self-administered questionnaire, and this questionnaire was further divided into 4 sections. And the first section was the social demographic background, looking at the gender, age, highest education status, ethnicity, monthly household income, and employment status. And the second component would be the anthropometric measurement, where we will ask the respondent to record their height and weight, and we'll measure their body mass index according to the WHO cutoff point. So we have also assessed their physical activity via the International Physical Activity Questionnaire short form, and we assess their mental health status by using Perceived Stress Scale, PSS-10, Patient Health Questionnaire, BHQ-9, and Generalized Anxiety Disorder, GAD-7. So for our results, we found out that a total of around 338 participants were recruited with a mean age of 33.7, plus minus 14 years old. So generally, for the anthropometric parameters, we found that there is an increase in the body weight and also an increment in the BMI before and during the COVID-19. So there is a significant increment where you can see that the body weight increased from 63.7 to 64.3 kg. And for BMI, there is a significant increment from 24.1 to 24.3 kg per meter square. And for the physical activity, you will see that there is a significant reduction from 2,906 to 2,600. And in terms of the sedentary behavior, there is an increment so from 6.4 to 7.1. So this is significant as well. So our result generally, we also found that there is an average weight gain of 0.6 kg among the Malaysians adult before and during the COVID-19. And this is consistent with the previous studies carried out in US and China. On the other hand, we also found that about half of our participants experienced weight gain during the COVID-19 as compared to before COVID-19. And this proportion is actually higher than previous studies that was reported in US and Chile. On the other hand, we found out that around 71.9% of the Malaysian remain physically active, and around 45.6% of the participants were sedentary. And this is consistent with the previous studies found in the among Malaysians, WHO, Kuwait, and Saudi Arabia. And in terms of the mental health status, generally we found that there is a significant increment in all the mental health parameters as measured by the stress, as measured by PSS-10 score. There is a significant increment in the stress, significant increment in the depression as measured by BHQ-9 score, and also a significant increment in the anxiety score measured by GAD-7 score. So our results is actually consistent with the previous study as well. As you can see, generally for stress, we also found that there is a generally an increment in the stress score during the pandemic than the pre-COVID-19. So similarly, the same goes to the depression and anxiety as measured by different countries. So we have further done analysis using the binary logistic regression, and we found out that the sedentary hours is the one which leads to the weight gain. So we found out that for 1 hour increment in the sedentary hours, there is a 1.068 times more likely to experience the weight gain in the participants. So generally, we've also found that this results is significant, and this is in line with other studies which shown that sedentary behaviors are linked to increased nagging frequency, and this will lead to overconsumption of the next meal and results in the obesity during the COVID-19. So as a conclusion, the weight gain during the COVID-19 should be given enough attention, and in Malaysia, adherence to the Malaysian healthy plate concept and healthy lifestyle should be promoted. And because sedentary hours is linked to the weight gain, so we propose that the strategies to increase the physical activity for sedentary lifestyle should be implemented during the COVID-19. So this is the references that I use in my research. And thank you so much for listening. So if you have any questions, please feel free to drop me an email. And my email is Shi-Hui.Cheng@nottingham.edu.my. Thank you so much for your attention.